Welcome to this Informed Dental Consumer presentation. I'm Dr. Beth Dorian. In this video, I'm going to explain the importance of your periodontal health and how we can retain it or achieve it. I'll also show you what we're looking for when we're assessing your periodontal health. The more you know, the more empowered you are to make the best decisions for your health and your wallet. What does the word periodontal refer to? Peri means around and dontal means teeth. So your periodontal tissues are your gums, bone, and ligaments supporting your teeth. Pretty much everything but the teeth. Periodontal disease is a chronic inflammatory condition causing destruction of these periodontal tissues. It's commonly called gum disease. Gum disease is triggered by a complex interaction between our dental plaque and our immune system. It affects a very high percentage of adults. One of the tools we use to assess your periodontal health are dental x-rays. They show us your bone level. The top x-ray here shows a healthy bone level, while the top x-ray here shows a healthy bone level offering good support to the teeth. The top x-ray here shows a healthy bone level offering good support. The top x-ray here shows a healthy bone level offering good support to the teeth, while the bottom x-ray shows bone loss as a result of gum disease. Sometimes we identify that a tooth root's dividing point is now exposed to the oral cavity when it used to be buried in bone. And that makes the tooth harder to maintain in the long term because plaque can settle in that tough-to-reach location between the two. And that makes the tooth harder to maintain in the long term because plaque can settle in that tough-to-reach location between the roots. X-rays may also show us spikes on your teeth. These spikes are actually tartar buildup. Tartar is dental plaque that has been sitting around for a while and hardened. If spikes of tartar are visible on a dental x-ray, even just a little bit, it's a sign that there is quite a bit on your teeth. It takes a lot of buildup before it shows up on an x-ray. Unfortunately, tartar has a sticky surface, and that attracts a lot more soft plaque. And of course, that plaque can harden into even more tartar. Dental plaque is nothing more than a gooey collection of bacteria and bacterial byproducts. I can't pronounce most of the names on this chart, but here's a list of many species of bacteria that have been implicated in triggering this destructive immune response of gum disease. There are other species of bacteria that don't cause gum disease, but they cause cavities, and yet others that are friendlier and don't contribute to oral disease. Some of these bacteria combinations create the type of plaque that tends to harden into large chunks of tartar buildup that we can see easily on an x-ray, while others create much finer deposits of tartar that can be just as destructive, but they aren't visible on an x-ray. So now you know your susceptibility to gum disease as well as the characteristics of your tartar and plaque accumulation is a lottery system. It's largely dependent on the species of bacteria that comprise your dental plaque as well as your immune response and general health, all of which vary from person to person. While we can't control the species of bacteria we've acquired, we can do our best to limit the overall amount of plaque and tartar buildup, and that's a pretty effective approach for both preventing gum disease or managing it if it develops. We can't rely on x-rays alone to assess your periodontal health. X-rays show only hard tissue. Sometimes people have experienced bone loss from gum disease, but the disease is now controlled and the tissues are now healthy. In order to assess the actual soft tissue destruction, the extent to which the gums have detached from the tooth, we have to take the time to use an important but simple diagnostic tool called a periodontal probe. If there is no or minimal soft tissue destruction, it won't sink down very far. However, if some connective tissue has been destroyed as a result of gum disease, it will sink further down. It's like golf. Lower numbers are better. To get the full picture, we measure 6 places around each tooth. These sites are referred to as periodontal pockets. Generally speaking, pockets between 1 and 3 millimeters are healthy. A 4 millimeter pocket is either early disease or reversible. A 4 millimeter pocket is either early disease or reversible tissue swelling. 5 to 6 millimeter sites need 5 to 6 millimeter sites need attention and treatment. Above 5 to 6 millimeters 5 to 6 millimeter sites usually need attention and treatment. Above 6 millimeters, it gets tougher to treat. But these are guidelines. It can be a bit more nuanced than the simple way I presented it. We consider many factors. Sometimes we need to add the tissue recession, as represented on the left, to the pocket depth. And together they equal what we call attachment loss. There are many factors besides just probe depths that inform our treatment planning decision. There are many factors besides probe depths that There are many factors besides just probe depths that inform our treatment planning, but probing is essential. In fact, sometimes the probe depths offer the only clue that gum disease has developed. Believe it or not, if your gum tissue is healthy, we can insert this probe into the pocket and it won't hurt or bleed. Wherever the probe elicits bleeding is identified as an inflamed area. I do want to mention a small caveat for smokers. Oftentimes, bleeding will be less evident for smokers despite advancing disease. And by the way, smokers are also much more at risk of developing gum disease. If your gums are too inflamed to comfortably tolerate periodontal probing, or if you have a lot of tartar buildup, it often makes sense to wait until your hygiene visit before your gums are probed. Tartar buildup may interfere with accurate probe measurements. At your hygiene visit when you're numb and comfortable, we can get any interfering tartar out of the way, we can get meaningful probe measurements then. There's no reason to cause unnecessary discomfort or waste time. That said, the severity of disease and the full scope of treatment required may not be determined until we know your pocket depths. When we're young and get our new permanent teeth, we all start out with nice and shallow pockets. But if a little plaque settles in those shallow pockets and sits around too long, the disease process can begin. If the disease process was initiated while the pockets were nice and shallow and relatively accessible to clean, you can only imagine how the disease process can accelerate once the pockets get deeper and accumulate a lot more plaque. Remember, it was the plaque that kicked off the immune response in the first place, and as a result of that immune response, we're harboring a lot more plaque. Without treatment, this creates a never-ending, progressively worsening cycle of this destructive immune response and inflammation. It turns out that the more pathogenic bacterial species, the ones that most readily trigger that destructive immune response of gum disease, can be transmitted from person to person, even as adults. So once gum disease develops, the amount of bacteria in your mouth is exponentially greater. You'll have a lot more potential to transmit them to your loved ones. So treating your gum disease may not only benefit you, it may protect your loved ones as well. Fortunately, for the vast majority of people, no matter their dental plaque makeup, periodontal disease is preventable. Both good home care and regular professional dental cleanings, which should include periodic monitoring of your periodontal pockets, are enough to prevent serious disease. Unfortunately, not everyone has access to regular dental care, and that's what can get folks into trouble. The other problem with gum disease is that it typically does not cause pain. The other problem with gum disease is that it typically does not cause pain until it's very advanced. The other problem with gum disease is that it typically does not cause pain until it's very advanced. So during the treatable stages, people are not compelled by pain to see their dentist. We know life happens. It can throw a lot of distracting curveballs, and it's easy to see. It can throw a lot of distracting curveballs, and it's easy to see how dental care can end up on the back burner. But it's important to understand what happens when you don't treat gum disease. I'm sure it's easy to see how untreated gum disease will eventually result in tooth loss. The teeth will either just fall out or float in pus. The accumulating bacteria can also find its way into the tooth's pulp and cause the tooth itself to develop an infection along with the surrounding tissues. And these scenarios do cause pain and finally compel that trip to the dentist to have the offending tooth removed. Sometimes people with gum disease, even those who never got cavities before, are now getting a lot of cavities. And that's because there is a lot of exposed root surface that used to be protected by bone. Root surface is 700% softer than enamel and much more vulnerable to developing cavities. This man was not able to get preventative dental care and developed severe gum disease. He finally sought treatment when he developed toothaches from large cavities that resulted from root exposure. Here's an example of a much smaller cavity in the root. This patient had treatable gum disease, and fortunately we caught this issue in time, and we were able to do a small filling. Due to the potential for cavities in the soft roots, many dentists recommend routine fluoride application for those with gum disease. Fluoride makes tooth surfaces more resistant to cavities. But higher risk for cavities and tooth loss are not the only consequences. of periodontal disease, nor are they the most serious. The biggest concern of gum disease is the systemic health impact. There are many systemic diseases that have been linked to periodontal disease. Here are some examples. Your mouth is not isolated from the rest of your body. All of those inflammatory byproducts and the toxic bacteria in your dental plaque can get into your bloodstream and potentially cause blood clots or otherwise wreak havoc on your system. If you are diagnosed with gum disease, be sure that you are up to date with your physical exams. In some cases, it would be wise to specifically check your cardiovascular health. I hope it's clear how important it is to treat gum disease. Now I'm going to review how we do that. One surefire way to eradicate gum disease is to remove teeth affected by gum disease. Tooth removal is the only known cure for gum disease. For obvious reasons, it's not our first choice, but sometimes it's unavoidable or just makes the most sense. Once the teeth are gone, the toxic bacteria have no place to live. Their home is in between the teeth and the gums. When the teeth are gone, they move out. Here's a case where the disease was advanced enough that we could not save the teeth. So I removed them and made dentures. Of course, getting dentures is not a fun process, and we try to avoid it whenever possible. But people are resilient, and most denture patients Most denture patients successfully adapt to the change and rejoice in the fact that they're much healthier. Oftentimes, though, we just remove the teeth in the worst condition and replace them with a variety of methods. Oftentimes, though, we just remove the teeth in the worst condition and replace them with a variety of methods, such as dental implants. Oftentimes, though, we just remove the teeth in the worst condition, and ideally we replace them with dental implants. Oftentimes, though, we just remove the teeth in the worst condition, and the ideal way to replace them is with dental implants. Or we remove teeth that are what we call non-strategic. Here's an example. This circled tooth has no function or value. It doesn't chew for you, and it doesn't smile. It doesn't chew,